All right. Hello, everyone, and thank you for tuning in today to this talk about clarinet playing during pregnancy and the postpartum period. I'd like to start by sharing a bit about my story about how I became so interested in this topic in the first place. As you can see, I was pregnant and playing the clarinet. This photo is a selfie that I took when I was pregnant with my second son. With the E-flat clarinet makes the belly look a little bigger than it actually is. But I have two sons, they're 4 and 7 now, and I played throughout my pregnancies with both of them. And after my second son, though, I had a bit of trouble returning to playing the clarinet. I just felt like even after my embouchure had strengthened and recovered, my tone just wasn't quite right. I felt like something was going on with my air support, and it just felt off. But due to the hectic nature of being a working parent, freelancer, and having two kids, I really didn't put myself first during that time, and it took about a year before I finally realized I need to see a physical therapist and see if I can get some help with this. So I ended up with a fabulous physical therapist who I felt pretty much retaught me how to play the clarinet. It was amazing. She had me bring in my instrument into her office and play long tones while I was hooked up to biofeedback and things, just to try to figure out what was going on with my abdominal muscles, pelvic floor, all of these things. And in the end, the conclusion really was that I had been over relying on my larger abdominal muscle. It's called the rectus abdominis, which we'll look at in a minute. And I had never really re-strengthened some of the other crucial abdominal muscles as well as the pelvic floor. And once I had some personalized exercises to work on this, I really noticed a big change in my clarinet playing as well as just in day-to-day life. I felt like I could breathe better overall when I was holding the baby and things like that. So yeah, just a really amazing experience. And after that, I became so curious about the experiences of other people during pregnancy, playing the clarinet and other wind instruments, and I started looking into things. This resulted in the presentation that you're about to hear today. So, what we're gonna talk about. So I'm gonna be sharing with you some of my research from the medical literature about how pregnancy might affect the physiology of air support. Now, there's not a lot written about clarinetists or wind instruments in the medical journals and things, but there's a lot about what happens to the muscles and the respiratory system during and after pregnancy. There's also recommendations for female athletes that I think are really interesting and potentially applicable to what we do. I also did a survey of clarinetists who had babies about their experiences playing clarinet during pregnancy and the postpartum period. And I ended up with 57 respondents. They all identified as women, so 57 women who shared their experiences. And we'll be looking at some of the data from that as well and sharing some quotes along the way. You'll see on my slides, I'm not going to read all the quotes, but you can take a look at those and some of the experiences that women shared in that survey. And lastly, we'll finish up with some recommendations for players and teachers on a safe and healthy return to clarinet playing in the postpartum period. I want to start though with some terminology. Some of these terms and muscles were unfamiliar to me before I started physical therapy, so you might be in the same boat. First though, I want to refer you to Alyssa Powell's wonderful presentation that she gave last weekend at ClarinetFest. Clarinet breathing, anatomy, physiology, and pedagogy. And you can click on this link to find her presentation in my slides, which are also linked at the virtual ClarinetFest page. So you can pull up these slides that I'm presenting with right now. You can pull those up on your computer, click the links, and take a closer look at anything that you want to. But I really recommend starting with Allie's presentation because she got into a lot of the details that we don't have time to today about what happens with all of these muscles and things during breathing. But I do want to talk about two really important muscles. So the rectus abdominis here is the what we think of as the typical six-pack ab muscle. It's the one most of us are familiar with. And the transverse abdominis, or transversus abdominis, over here on the right is more of a band-shaped muscle that's a little bit lower in the abdominal cavity. And when my physical therapist was working with me, we did a lot of strengthening with that transversus abdominis and try to get me to stop over relying on this rectus abdominis. You can see here it actually attaches to the rib cage all the way down to the pelvis. So if you firm up your rectus abdominis like you're doing a crunch and you try to take a deep breath, you will not be able to because the rib cage cannot expand. But you can actually activate that transversus abdominis and still expand your rib cage and take a full breath. So it's one of these muscles that I have come to believe is really crucial for air support on the clarinet. And it's a muscle that's really affected. Both of these are very affected in pregnancy. So let's take a look now at some of the whole variety of physical effects of pregnancy on the human body. We know there are many. Just to start with some of the general things, fatigue, almost everyone experiences a lot of fatigue during pregnancy. The blood volume in the body, as well as the volume of blood pumped by the heart, increases by up to 50%. So you actually have 50% more blood in your body when you are pregnant. Many people experience morning sickness, and it's usually in the first 3 months, but in many people, about 20% of people actually have morning sickness throughout further than 20 weeks in the pregnancy, in some cases all the way through, and it can be quite debilitating. So that's an important concern. Lower back pain or pelvic girdle pain is really common, as well as incontinence. These are all some of the most common fun things that you get to deal with when you are pregnant. Then moving to specifics about the abdominal muscles. So we know that there's a weight gain of 25 to 35 or more pounds. And this is from medical journals, and this information here, I found that 65% of this weight is actually in the abdominal area. The rest of it is spread throughout the body, but that's a lot of weight being added there by the end of the pregnancy. The intra-abdominal pressure increases. I'm going to be referencing this a little bit because this is the pressure below the diaphragm in the abdominal cavity. The diaphragm, as Ali outlined, separates the thoracic cavity with the rib cage and the lungs from the abdominal cavity, which has the abdominal viscera and, of course, the baby during pregnancy. So during pregnancy, that pressure increases. It also increases when you play a wind instrument. So something to keep an eye on, because heightened abdominal pressure can be a risk factor for certain conditions. The diaphragm shifts up in the body, upwards, by 1.5 to up to 4 centimeters. It's a huge shift of the diaphragm, so important to clarinet playing. The abdominal muscles thin and lengthen to make room for the baby. Their action and functionality is reduced, and the action of the rib cage muscles is reduced. Looking at the respiratory system specifically, the rib cage moves gradually up and outward over the 3 trimesters. And this was one of the most fascinating things that I found out in my research. It's from a pretty recent study, that despite this rib cage changing in shape and the baby growing, the diaphragm shifting up, the lung volume actually does not change. So the body adapts in really amazing ways to keep most of the functionality of a non-pregnant person. And one of the things the body does is increases the amount of air that's inhaled and exhaled per minute by up to 50%. And that's at rest. So actually the amount of air coming in and out increases through various mechanisms. But the main thing that we feel when we are pregnant is that the body is less able to increase this volume during stress or heavy exercise. So we do have a reduction of the reserves that we are used to being able to access when we're at the extremes of our inhales and exhales. So the ability to do strenuous exercise is impaired, and there's less oxygen available for that, despite the fact that we actually have more oxygen than before we were pregnant in general at rest. So I found those things really relevant and interesting. And now let's take a look at some of the results from the survey of what clarinetists said, what physical challenges they had that affected their clarinet playing. So these are only the things they felt affected their playing. The number one complaint was shortness of breath and difficulty taking full breaths. So we could be seeing there that difficulty of accessing the reserve volume. 67% said their fatigue affected their clarinet playing, and then 59% mentioned a lack of air support. So that's a little more related perhaps to those abdominal muscles not functioning in the same way as they used to. Almost half said there were just body changes affecting their posture or playing position. 40% experienced dizziness or low blood pressure. This happened to me when I was with both of my kids. I think when I was about 4 months pregnant, I had low blood pressure and I actually couldn't stand and play. I would start to pass out if I did that. So I had to sit during that time. Then we see nausea or morning sickness, back pain, heartburn, acid reflux, swelling. If you take a look at the quote where she says, "I could barely take a deep enough breath to sustain any length of phrasing." Also, the swelling made it really hard to sit for long periods of time. So here we see the opposite complaint, someone perhaps later in pregnancy with swelling, that they actually had to perhaps stand and play, or at least move around, move back and forth. These are all important considerations if you're thinking about programming and logistics for concerts and things. And then I want to point out their carpal tunnel and high blood pressure, especially the carpal tunnel. If you're predisposed to that, that could be something to just be on the lookout for, that pregnancy can exacerbate or cause carpal tunnel. So how did these changes affect women throughout the pregnancy? What's the timeline here? By the 5th month of pregnancy, 38% of women started to feel that the pregnancy was affecting their playing. By the 7th month, it was up to 74%, and by the 9th month, 86% felt that it did affect their playing. And I asked specifically about the auxiliary clarinets. So only one person mentioned they had a little more hand and wrist pain on the E-flat clarinet during pregnancy. 9 people, though, out of 57 mentioned the bass clarinet having specific challenges with air support or the angle of the instrument being kind of difficult. And 2 people mentioned difficulty carrying the bass clarinet in the case. So again, this is something to think about regarding programming. Maybe hold off on programming those bass clarinet works, or at least have a backup plan, right, in case it starts to feel uncomfortable. From the survey, one of the things I was the most interested to find out is how long did women continue to play during their pregnancy, and how did they feel about having to stop at a certain point due to the physical challenges, or maybe having to continue or wanting to continue. So what I did find was that 54% of women continued to perform and practice throughout their pregnancy, like I did. Played all the way up through week 39 in my last pregnancy, and many women do the same thing. But in month 5, some women began stopping performance and practice activity. That's right around when we started seeing those effects build up. And then by month 9, 45.6% of women had stopped practicing and performing. So about how they felt about these decisions, if we look at the chart here, we can see in the blue, 40% of women were kept playing and they were happy to keep playing. They were satisfied with that. But of those who had to continue playing throughout their pregnancy, 9% were dissatisfied with that. Several women in the surveys mentioned that they had to continue playing beyond where they felt comfortable because they felt obligated to do so. In some cases, there might just be career obligations and a lack of workplace flexibility for them to stop when they actually wanted to, or financial concerns as well. Then about people who had stopped playing, 19%, about half of them were satisfied to stop playing when they did. Physical challenges got too great and they were fine with that, stopping playing for a while. But 23% were dissatisfied to stop playing. So that's almost 1 in 4 women that were not anticipating perhaps having to stop when they did and ended up not being able to play. So it's a pretty important point to consider for teachers and clarinetists that it's quite likely that you might encounter challenges that could seriously affect your ability to play. Now, after the baby, we enter the postpartum period, and it's related. It got a lot of its own related but different challenges here. So in general, you see fatigue. You're going to be breastfeeding or pumping 8 to 12 times a day at first in the newborn phase. There's a lot of postpartum depression and anxiety. And the respiratory, I shouldn't say a lot for everyone, but about half of women do experience some depression or anxiety. About 20% are diagnosed with postpartum depression, so 1 in 5 women. The respiratory system does recover within about 6 to 12 weeks postpartum to its previous pre-pregnancy functionality. But pelvic floor weakness, incontinence, pelvic organ prolapse, these are all common during this period. And then for people who end up having a C-section, that can cause a longer recovery time, 4 to 6 weeks, until exercise is really recommended. Looking specifically at the abdominals and what the medical literature tells us happens, it's quite fascinating how these muscles recover. So it usually takes, one study found, about, on average, 8 weeks after birth for the abdominal muscles to be able to stabilize the pelvis against resistance. So this study specifically looked at being able to stabilize the pelvis against resistance. To me, this is just kind of my own connection here, but I feel like what we do when we play the clarinet could have relevance to that, and it could be 8 weeks until we're able to stabilize our pelvis in clarinet playing situation and with air support. The rectus abdominis likely recovers first. One study looked at how much time each muscle takes to recover. So the rectus abdominis took about 1 month to recover its functionality. The transverse abdominis took at least 4 months. And the internal oblique muscle 6+ months to recover. And the study found that internal and external obliques could be overused to compensate for the weaker transverse abdominis. And in my case, this fact is super relevant because I found I was over-relying on the rectus abdominis. And it's no surprise really that could happen. I feel like that could be more common than people realize because that transverse abdominis, that band-like muscle that's down low, takes at least 4 months to recover its functionality. So our body could try to start relying on different muscles than it actually should if that's not strengthened strategically. Lastly, diastasis recti is a major concern. Pretty much most women experience diastasis recti. It's where the rectus abdominis muscles actually separate. So most women do experience some degree of this by the end of pregnancy, and it usually just resolves on its own. But even after 12 months postpartum, I think 1 in 3 women still have diastasis recti. So diastasis recti is one of those things that may need physical therapy to help repair, and that anything that increases intra-abdominal pressure can worsen it or delay the healing process for that particular condition. So if we think about wind instrument playing, increasing intra-abdominal pressure, we can see that we could have some issues here. Looking at the survey and what women said about the postpartum period. So 19% of women had no physical issues in the postpartum period that affected their clarinet playing. 46% said their fatigue was an issue with their playing. 44% lack of embouchure endurance. 1 in 3 reporting a lack of air support. And then we have some pelvic floor related things like incontinence, diastasis recti, pelvic floor issues that can all be related to the pressure of playing the instrument and weakness of the pelvic floor and possibly other muscles in air support. How soon did people return to playing the clarinet? This is possibly the number one question that I had and that I know a lot of people have when they first become pregnant. You have to start making decisions about what gigs are you going to take. We often plan gigs 1 or 2 years out, right? So can we predict what's going to happen and how we're going to feel? The answer is we can't always predict what's going to happen or how we're going to feel, but we can get an idea of what happened for this particular cohort of women. So as far as returning to practicing the clarinet, 10 out of the 57 returned less than a month postpartum, started playing a little bit. Most of them had returned by 1 to 3 months postpartum there. And as far as returning to performance, we see around 3 months a big spike in when people came back. Some people returning to, 4 people reporting they returned to performing less than a month after giving birth, which is amazing, and more power to them. Some women just really do bounce back quickly, but many don't, and you can't always predict how you're going to feel. And we also don't know how safe it is to really return to intense activity within the first month or 2. And then you can see some people waited until about 6 months before they started returning to performance. And then some people didn't even start back practicing or performing until 9, 10 months or even a year afterwards. One person reported never returning to playing after that. So that's the data we have on that. Turning back to the medical literature about recovery in the postpartum period, I found some information from recommendations for female athletes about returning to exercise, which I think we're athletes in a way, right? We do have to train these muscles, and I think there's some things we can learn from these recommendations for sure. So low impact activities like walking and aerobics, these put less pressure on the pelvic floor and can resume soon after the birth. And strengthening exercises postpartum, though, should start with a pelvic floor muscle first focus. So contracting the pelvic floor, which is also called a Kegel exercise, during exercises that increase that intra-abdominal pressure. So before doing heavy lifting, abdominal training, things like that. During pelvic floor contractions, one study found, or several studies I think have found, that the transverse abdominis and the internal obliques co-contract with the pelvic floor. Now the pelvic floor is kind of a dome-shaped, or I guess maybe hammock-shaped muscle throughout the pelvis. When that contracts, these others kind of automatically contract as well. So everything is linked and connected. We may not necessarily be kegling while we play the clarinet. It's kind of, believe me, I've tried. It doesn't really work for very long, but we can get these muscles to work better together, and we can just strengthen everything in a healthy way. The transverse abdominis has been called by one author the key to overall spinal stability and abdominal strength. Perhaps a key to air support as well, in my opinion. Abdominal exercises are most effective when they're done several times a day for short periods. So another thing to keep in mind for re-strengthening any kind of exercises, that you don't want to do like an hour session and then take a few days off. It's better to just do a little bit at a time every day. Looking at our survey about how people used physical activity to recover. 75%, the largest thing reported was cardio exercises like walking, running, biking, swimming, and those are the best, as we saw from the previous slide, those are the best to start back with. 53% said Kegel exercises were important in physical recovery. 26% said yoga. Those were the top 3 things. Only 17.5% of these 57 women mentioned that they did postpartum physical therapy. Half of those who did said that the PT was helpful to their clarinet playing, and all said it was helpful to their general postpartum recovery. So they rated at least 6 on a scale of 1 to 10 as far as how helpful it was. In some countries, especially in Europe, physical therapy in the postpartum period is routine, and most people do it. In the US, as these numbers speak to, we probably had more US respondents than from other countries, although I didn't specifically ask about that. But in the US, that number is much, much lower. It's just not quite routine, but there's a lot of people who are advocating for that to become more routine as far as insurance, what health insurance covers, and just in our culture. So I'd like to finish up here with some recommendations for clarinetists and those around them. So starting with clarinetists, this is partly based on my research and partly just personal experience here. Definitely have backup plans. It really is impossible to control or predict what's going to happen with your body and how you're going to feel during and after pregnancy. There's a lot of hormones, there's a lot of emotions involved with this major life event. And I know women who planned to return to playing at a certain point, like at 2 months postpartum. When that 2 months came up, they just did not feel ready to get back into it. They wanted more time at home. They needed more time with the baby at home before getting back fully to work. But I also know women who started going crazy about 3 weeks postpartum and just wanted to get back into their routine and their work. And they were happy if they could to find childcare and get back into things. So in some cases, women were surprised by how they felt regarding those. They maybe thought they wanted to stay home, and then when they got in that situation, they realized it wasn't the best fit for them. So it really is impossible to predict, but if you have backup plans, then you're going to be good. When returning to play, you can use softer reeds to reduce that pressure and just get the embouchure rehabilitated. Gradually strengthening the core with a focus on pelvic floor first, as these recommendations for athletes told us, and then also working with the transverse abdominis. I think sometimes of the yoga terms Mula Bandha and Uddiyana Bandha. These are the two locks, these ancient recommendations from about the 12th century, these two locks in the body that are really important to yoga. These correspond directly, Mula Bandha to the pelvic floor muscles and Uddiyana Bandha to the transverse abdominis muscle. Kind of interesting. Postpartum physical therapy is highly recommended if you haven't already gotten that from this presentation. Really helpful to have just personalized exercises and somebody who can answer your questions. You can also find resources online if postpartum physical therapy isn't available to you. You can find some websites and exercises for strengthening the core after pregnancy. I would recommend that you aim for the quality of practice, since the quantity may not be available to you as before having kids. I think both men and women, all parents, can agree that your time just is no longer yours anymore. And from the survey, we had many comments about not being able to practice as much and that having a big effect on clarinet playing. In a lot of cases, though, it makes you more efficient. So you do have to be just super focused. If you only have 45 minutes to practice and it's 10 p.m. After the baby's gone to bed or whatever, you're going to have to just be really focused on doing a good warm-up and then getting done what you can get done in that time, and then you're done. So it can actually be a positive for learning how to practice super effectively. Lastly, prioritize your physical and mental health, please. It's hard, especially if we may not have the family leave policies in place to allow us to do that, but that is what's most important. Last slide here, some recommendations for teachers, administrators, ensemble directors, anybody who really interacts with wind instruments, who are pregnant or may become pregnant, wind instrumentalists. So the number one thing is just be aware of some of these physical challenges that may be faced during this period. Number two, be prepared to make appropriate accommodations. I think we're all in academia and elsewhere getting used to making accommodations for various disabilities, and I think we can link in accommodations for pregnant and postpartum women right in there with as far as scheduling, Degree plans can be affected. There may need to be some flexibility with when the recitals happen or extending timelines. Repertoire, maybe avoid that bass clarinet or that contrabass clarinet piece for a little while, or at least have a different choice if you need to sub that out. Logistics, and allowing space and time for breastfeeding or pumping, and that is federal law in the US. So respect each individual's requests and decisions regarding the accommodations. If you're not sure, just ask somebody, ask them what they need, or say, how can I best support you during this time? Be familiar with the family leave provisions. I have a couple links here to a list of different countries and what they provide as far as family leave. Sadly, the US is at the bottom of that list with no paid leave mandated at the federal level currently, which is very sad because it forces a lot of really difficult decisions for people. But many states have started to enact paid leave provisions, and those are linked here for the US states as well if you want to look into that. So lastly, I encourage you to be an advocate for family-friendly policies at the national, state, local levels, but especially within your own institutions or organizations. If there's something you can do, whether it be finding a way to offer paid leave or partial paid leave so that people have an opportunity to make the decisions that they need to make during that time, that's great. Policies that are great not just for women and mothers, but for men, for families, all of that I think is trending towards being more accommodating for people, which is a very good thing because we know there are things that are more important than work, right? So doing what you can to advocate for women is so important. It's something I feel really strongly about because we do see less women in the field of clarinet playing at the very top, despite all the amazing women that we have, the amazing clarinetists and teachers in this world. There is a certain imbalance there, and especially you don't see a lot of women with children that are in high profile positions. And I offer that one of the reasons is that pregnancy is a really big life-changing event, and because of all these physical challenges, not to mention all the social, emotional, and just logistical challenges, that really does keep women out of the field that should be there. So anything we can do to support that, I think, is a very good thing. I'd like to finish just by thanking the ICA for having me here doing this presentation. I want to thank Megan Taylor and Kensley Bahel, who helped provide feedback on the survey, and Tori Akwabi, Kelly Licknitz-Hahn, and Deanna Brisgies for testing the survey before it went live, and my wonderful physical therapist, Vonda Zekli. If you have any questions or comments, I would love to talk with you right now if you want to ask in the Q&A. And beyond that, you can definitely send me an email at rachelyoder@gmail.com.
Awesome. So, does anyone in the session have a question for Rachel? I know Rachel received some questions outside of the presentation for people who couldn't be here, and feel free to sort of address any of those questions as we wait.
Sure. Yeah. One thing I'll just mention first off is that that career advancement can be affected by pregnancy, sadly, and that's one of the things that I've heard from people is that while it is illegal to discriminate against a person for being pregnant or having a child, that in reality, at least by people I've talked with in the US, we see in some cases tenure decisions or renewals of contracts being affected, and most of the people making these decisions in a couple cases I'm thinking of being men and people who may not really recognize the challenges that are happening. And so I think that's something that we can really work to change, because the physical part is something that the partner cannot really help with. It's something that a woman goes through and has a lot of big effects, as we've seen in the presentation.
Well, I'll ask a question because I recently, actually for the first time, had physical therapy, not for anything like this, but for a groin and like ankle injury due to running. And can you talk a little bit about what the physical therapy sessions entail and how you might consider, if you don't have insurance, going about scheduling something with a physical therapist? I think many people might be curious about what those kinds of exercises and things like that they do during a therapy session would look like.
Sure, yeah. So I can't really speak to the specifics of insurance because I think it depends. In my case, it was mostly covered with a copay for postpartum, but I think I did about 6 sessions, and it was every week or every 2 weeks for a period of time. I would show up, and the first session was kind of a general assessment and talking about what was going on and any issues. And then I started getting exercises prescribed just for me, which was really cool. Some of the things to strengthen the transverse abdominis were, one thing that I think helped the most I can describe is laying flat on your back with your legs up, kind of with shins parallel to the floor, and doing heel taps. So tapping your heel 10 times, tapping the other heel on the ground 10 times, and that really works to strengthen those lower, the transverse abdominis muscles. And then there was pelvic floor strengthening at the same time. So I was supposed to co-contract everything, or contract the pelvic floor first before doing anything else.
Great. Does anyone else have any questions for Rachel before we finish up our session today? I see a question here from Margaret. She's saying, during your pregnancies, did you play all throughout both pregnancies, or did you have to take a break from playing during one or both of them?
Yeah, so I did play pretty much throughout. I remember I did a concert about 37 weeks pregnant with my first, and then I took a break after that. And with my second, I did a concert that was totally optional. It was just kind of a clarinet choir for fun that's organized here in Seattle, that if I didn't show up, it was no big deal. So I think that kind of gig is great. But I actually played this gig on bass clarinet at 39 weeks just to kind of prove that I could, I think, in a way. It was also fun. But yeah, if you're going to schedule anything in those last few weeks, you really got to have a backup plan and know that you may not be there. And then after the pregnancy, I will say I took at least 2 weeks off before I started returning to like some breathing and just playing for very short periods of time, like 5 minutes, and then kind of gradually strengthening. And it's worth mentioning that this is really relevant to anyone who's undergoing abdominal surgery or like hernia surgery or anything like that, that a lot of the same considerations can be applied.
All right. Well, you have Rachel's slides on the website and on the guidebook, and her email address here, rachelyoder@gmail.com. Please reach out to her if you have questions that come to mind after the session is completed. If you joined us a few minutes late, this session will be uploaded to YouTube in just a few minutes. So thank you so much, Rachel, and we will see you all at the next session, which starts at 3 o'clock on YouTube. That's Eastern.
Thanks, everybody.
Time, so.